action from across every state, county, and city in this entire lovely country in which we live to draw attention to the fact that far too many people are losing healthcare, that healthcare has become far too expensive. And because of federal cuts, it is harder and harder to make ends meet while providing for our families, while also making sure that we and our families receive the best possible care. We are joined here tonight with nursing home and home caregivers from across the state. We're also joined by State Representative Izzy Smith-Waddell. Thank you for being here, sir. And you'll see in front of us, behind us, all around us on these steps of our beautiful state capitol are 1,450 candles. Each one of these candles represents 100 Pennsylvanians who have already lost their health insurance just this year in 2026. And that is because last year, Congress refused to renew the enhanced tax credits on the ACA market exchange. When January 1 of this year hit, far too many families, including here in Pennsylvania, saw their premiums go up, and not just by a little bit, not just by a fraction, but by double, triple, quadruple, 700, 800 times their monthly premium. And for far too many families, especially as we are struggling at the pump to pay for gas and put gas in our cars, especially as we are struggling at the grocery store, the cost of groceries are going up, the cost of energy is going up, the cost of housing is in a real crisis in our communities. On top of all of that, far too many families in Pennsylvania just weren't able to afford those raises in their healthcare costs. And so that's why we're here tonight. We're here tonight in front of our state capitol because the people in this building, the state representatives and the state senators who come in here and work every single day, have a choice. They have a choice to make. Are they going to stand with us, hard-working Pennsylvania families, or are they going to stand with the billionaires who asked them to make these cuts so that they can enjoy even bigger tax breaks? And we're not only here tonight with our vigil to call on those in our state capitol to do the right thing and stand by us, but also because of that building right over there. That building just across the way is the Commonwealth Foundation of Pennsylvania. They are the billionaires' lobbying arm here in Pennsylvania. They lobby for less money to go to healthcare, for less money to go to education, for less money to go to infrastructure, and for more money to go into the pockets of the billionaires. And so we're here to call on them, the bosses and the billionaires, and to call on our decision makers here in our state capitol and say enough is enough. We are sick, literally, we are sick and tired of this. Every working class family, every working class person here in our Commonwealth deserves access to high quality, affordable health care. It is a shame that in the richest country in the world, we have to be out here to call attention to the hardworking people who have lost their health insurance simply because of the failure of Congress to act. I want to call up a couple speakers, and I also want to invite others who are in the crowd to come and join us and share their stories tonight. But before we get into that, I just wanted to center us on the fact that these 1,450 candles, again, each one representing 100 Pennsylvanians who have lost their health insurance so far in 2026. These are not just names on a list. These are not just hardworking people who get up every single day and go to work to put food in their mouths, in their families' mouths, and in their pockets. These are children. These are people with disabilities. These are families. And we anticipate that if we had had this vigil in December of this year, there would be a whole lot more candles. Because it is not just the failure to extend the tax credits that is robbing from Pennsylvanians our health care. There is over $1 trillion in Medicaid cuts handed down by Congress that is coming to hit our state in October of this year and next year. When we come back next year, we will fill these steps with candles. That is disgusting. That is appalling. That is a tragedy. But there's something we can do about it. We are not totally hopeless. We are here tonight to respect and honor those who have lost their health care. And we are here tonight to call on the decision makers, whether they be private or public, to stand with us, the working people of Pennsylvania, and prioritize healthcare. Put money into healthcare, not into tax breaks for corporations and the billionaires. I'd like to invite the audience with me tonight to just join. True to form, we're going to do a little chant. And so I'm going to say, healthcare
saves lives.
Healthcare
Saves lives.
Healthcare
Saves lives.
Medicaid
Saves lives.
Medicaid
Saves lives.
Medicaid
Saves lives.
Penny
Saves lives.
Penny
Saves lives.
Penny.
Saves lives.
Thank you for raising your voices with me. And before we open up to speakers, I did want to, again, bring us back to the fact that these are people's lives. These are people's livelihoods. This is whether or not people are going to be able to afford that prescription or go to that doctor's visit or get that thing taken care of they need to get taken care of, or whether or not, frankly, they're going to die. We anticipate that these federal tax cuts, these federal healthcare cuts will increase the amount of preventable deaths in Pennsylvania every year by at least 950. 950 preventable deaths simply because people have lost their health insurance. Now that might not seem like a crazy number to some of you, but when you think about how many people in Pennsylvania die every year in vehicle accidents, it's about 950. As many as will die unnecessarily simply because their health care is being ripped away from them. That is unacceptable. And so before we open up to speakers, I just wanted to take a moment of silence to reflect on all of these individuals and families who have lost their health insurance. Thank you. I want to welcome up Suzanne Ott, who is a home care worker. Oh, where are you, Suzanne? Here she comes.
Good evening. My name is Suzanne Ott. Good evening. My name is Suzanne Ott. I've been a home care worker for almost 14 years, and I live in Franklin, north of Pittsburgh. I currently care for my partner, Andre, who suffers from multiple strokes. He has heart problems and is now nonverbal. So I'm here to be his voice, and I'm here to speak out for the 6,000 Pennsylvanians who are going to lose their health insurance because of federal cuts, possibly including myself. I help Andre with all of his daily activities of living that full able people take for granted, like myself. I get him up in the morning, I take him to the bathroom, I help him with showering, and I get him dressed. I make his meals, I feed him, I bring him to all of his doctor's appointments, I provide physical and speech therapy, I remind him to take his medicine, I help him with his finances. His home care is funded through Medicaid, and if he didn't have that care, he wouldn't be able to live. Uh, because I don't make enough money to afford private health care. I also depend on Medicaid, and so do my youngest two children. I'm very scared that because of federal cuts and the big one ugly beautiful bill, Andre might lose his home care hours, or I might lose my health care and get sick and not be able to take care of him, or my children might not even have health care, and that's kind of scary to me. I'm also worried that my best friend Lynn, who's in Allentown, she's another home care worker. She was getting her health insurance through Penny under the Affordable Care Act, and she was paying $300 a month. But because the federal government ended the subsidies for working people, her premium more than doubled, and she still has to pay that out of pocket. I have another friend named Wanda who had to drop her coverage. There are a lot of misconceptions about Medicaid and Affordable Care Act. First of all, the majority of those programs, people that rely on them, are working people. We work in some of the most important jobs in the world, like healthcare, which is essential for our country. But we aren't paid enough to afford private insurance. It makes me angry that politicians passed the biggest cut to healthcare in American history just to fund the biggest tax giveaway to the rich in American's history. Our elected leaders are supposed to work for us and in our best interests of the American people. As far as I'm concerned, the White House and the Republican Congress have committed treason against us, the American people. But now I have hope because working people are waking up. They're seeing that while we're struggling with the cost of healthcare, gas, groceries, housing, and utilities, the billionaires just keep getting richer. Our number one priority has to be to kick every single politician who voted for these healthcare cuts out of office. I know I'll be very involved in this election this November, and I urge everyone to get out there with me so we can protect healthcare in our future, in the future of our communities. Everyone should get out and make sure that you guys are all registered.
Thank you, Suzanne. Are y'all going to get out and vote in the midterms?
Yes.
And why? Because healthcare, Medicaid, Penny. Thank you, friends. I wanted to invite our good friend and healthcare champion in the state representative, House of Representatives, State Representative Izzy Smith-Waddell. Come on. Thank you, sir.
A thing occurs to me, as Aaron pointed out. I just like to talk about what we're talking about. There's 1,450 candles here, and the truth is that next time we're here, some of these candles will simply have gone out. People will have skipped a doctor's appointment, not been able to afford radiation or chemotherapy, and they will quite simply be dead because the choice that someone in Washington who never met them, who never met their family, made to be obedient to some lobbyist, to some billionaire, instead of the people that elected them.
That's right.
My mother passed away in 2018 from triple negative breast cancer. She was diagnosed when I was 18 years old. I mention that because the first doctor we went to see looked me and my brother in the eye and said, you know, this is my first case of triple negative breast cancer. I'm so excited. So we went and we found a new doctor because my mother's union secured health insurance made that possible. We went and we found a doctor who specialized in triple negative breast cancer in African American women. And the difference that that made was that we thought we were going to get 1 year with my mother, and instead we got 10 more years, an entire decade together as a family. First of all, that is the power of a union. But more importantly, every family in the Commonwealth deserves what my family got. As a state representative, I enjoy extraordinary health insurance. Every single congressperson enjoys extraordinary health insurance. And let me tell you something that you already know. We do not work harder than you do.
That's right.
We are not any better or more deserving than all of the people standing on these steps. But we feel entitled to give ourselves the best possible health care. Annual raises linked to inflation, but we won't raise their wages. Is that right or wrong?
Wrong.
Is that right or wrong?
Wrong.
See, the folks in this building over here, what they rely on is that most legislators listen more to them, the people who put money in their campaign bank accounts, than they listen to their constituents all across the Commonwealth of Pennsylvania. So let me just bring this home. This is not a black or a white issue. It is not a rural or an urban issue. Medicaid cuts do not just mean that individuals will go without health care. They mean that institutions that rely on Medicaid payments on behalf of their patients will close. And there are 12, count them 12, hospitals in the Commonwealth of Pennsylvania that serve rural communities who fall into that status. So what that means is that when a mother in Venango or Elk or Clinton or Potter County is up in the middle of the night because her baby has 103-degree fever, she will have to drive another hour and hope that that precious child makes it in time. And perhaps the worst part about that is that that simply does not have to be the case. In the Commonwealth of Pennsylvania, instead of taxing working people, instead of closing schools and closing hospitals, we can get new revenue by taxing billionaires, by not letting corporations send their profits out of state, by taxing digital ads. We have options in the Commonwealth. And instead of upsetting people in that building over there, we choose to let our fellow Pennsylvanians die. And that simply cannot be the case any longer. Thank you.
Wanted to bring up our next speaker, Brother Anthony Laws.
Woo! Woo!
Hello, everyone. Are you fired up to be out here tonight?
Yeah.
Well, y'all can't hear y'all.
Yeah.
Right. My name is Anthony Laws. I've been a CNA certified nursing assistant for over 32 years. I've worked in dozens of nursing homes throughout Pennsylvania. I currently work in a nursing home in Prospect Park in Delco. I started my caregiving career helping my grandmother take care of my great-grandmother, and then my mother take care of my grandmother. Then eventually I had to take care of my parents. So I take this work very personally, and I take these healthcare cuts very personally. I've worked in so many nursing homes that I've seen firsthand the decline in funding, treatment of workers, and quality of care in nursing homes. I've been taken over by corporate monsters, and funding has been cut to the bone. We out here struggling, right? We out here struggling. Understaffed, in unsanitary conditions in our nursing homes throughout the state. And it's getting even worse. Since the passage of this big bag of, listen, man, we're going to keep it clean. All right? We're going to keep it clean. Right? That's how I feel about these healthcare cuts. These cuts are putting a chokehold on our nursing homes and the care we provide. In anticipation of the funding cuts hitting our nursing homes, we are already cutting back on staffing, supplies, and I've gone out personally and bought hygiene products for my clients and my residents. I've seen so many staff walk out the door and go to make more money in fast food because that's what they had to do to feed their families. We have nursing assistants taking as many as 17 residents each. We're taking care of the most fragile people in our society, and this is unacceptable. In addition to funding cuts for our nursing homes, 600,000 Pennsylvanians are losing their access to health care. Our government is supposed to be for the people and by the people. Instead, what we have is a government of billionaires, for billionaires, and by billionaires for self-enrichment. They're turning health care into we don't care. They don't give a damn about us. They don't care. These health care cuts are hurting everyone across Pennsylvania. Race, political party, it don't matter. We have to stop fighting each other and fight the true enemy. Here and there.
That's right.
We have to make sure billionaires pay their fair share of taxes to fund nursing homes and hospitals and home care programs. One day we're all gonna be in their shoes as residents and patients. So let's keep building unity, speaking out for a future where all Pennsylvanians and all Americans will have the health care they need. Thank you.
Thank you, Anthony. Before I bring up our final speaker, I just wanted to hit on a couple things that Anthony brought up there. The cuts that we're facing, the loss of health care that you see all around us tonight, that we know and we feel all around us every single day here in Pennsylvania, are only going to get worse. Anthony talked about the 600,000 Pennsylvanians who will lose health care because of H.R. 1, because of Trump's big, beautiful bill, which cut over $1 trillion from Medicaid. These candles don't even represent that. These candles don't even represent the children, the people with disabilities, the families, the residents, our consumers, the patients, and the families all across Pennsylvania who are gonna lose their health care because of these cuts. And why? To give billionaires an even bigger tax break. That is disgusting. That is unacceptable. But you know what? If it were up to the politicians and the billionaires, they wouldn't care if we filled these steps with candles. They wouldn't care how many of them get snuffed out. But I am hopeful that with our work together, as nursing home workers, as home caregivers, as hospital workers, as patients and ourselves, that we will be able to unite and fight back. And that fight back, it didn't start tonight, it started months ago. We've been engaged in this for a long time. But tonight is a part of that. And it is also not the end. We're coming back to this building when they're here tomorrow morning, and we're gonna let them know they gotta put money into healthcare, not into tax breaks for the richest corporations and individuals.
That's right.
We need to tax the billionaires and fund healthcare. What do you think? Tax the billionaires, fund healthcare. Tax the billionaires,
Fund healthcare.
That's right. So we'll be back, but before we adjourn for this evening, I wanted to bring up our dear friend and leader, Helen Burke.
Good evening, y'all. My name is Helen, and I'm a home care worker in Lake City, up in Erie County. Whoa!
Nice catch.
Quick hand. I care for a beautiful woman who has cerebral palsy. She can't, do daily activity things. She can't get out of bed. She can't shower by herself without help. And she goes to work 35 hours a week. I'm speaking out tonight because I'm a strong believer that every individual deserves quality health care and the freedom to age at home with dignity. Our population is aging rapidly and struggling with chronic diseases and needs more care than ever before. But instead of investing in care, politicians have bowed down to the billionaires. They're kicking 600,000 Pennsylvanians off of their health care just to give money to the rich who don't even need it. I'm scared to death what's going to happen if my client loses her home care services by these Medicaid cuts. I also depend on Medicaid to pay my Medicare premium. Without Medicaid, I'd be screwed because I'm already stretched thin. See, I make $1,600 in my disability a month. It used to cost me $40 to fill my Kia Soul. It now costs me $80 to fill my Kia Soul. I have to pay $300 in my car loan. I have a $390 mortgage. I have a $140 car insurance, $100 for electric, $40 for gas, and $500 worth in groceries to have to provide a month. You do the math. I don't have a dime to spare. I have a dartboard. I'd like to ask these politicians in this building right here, if we healthcare workers can't stay healthy, who's going to care for them or their loved ones when they need the care in their home, in the hospital, or in a nursing home? These cuts are hurting those closest to me. I have a dear friend who was getting her care through Penny, but can't afford her premium now because of the federal subsidies cuts. She was paying $175 a month, but it went up to $450, and she had to choose between health coverage or food for her kids. Now, mind you, she's a diabetic. I grew up in a middle-class family, and I remember a time when just one job, my dad's job, covered all the bills in the house for the entire family, including health care. Now, thanks to policies like the one big ugly bill, and let's call it what it is, it's an ugly bill, there is no middle class. There's just the rich and everyone else barely scraping by or working 2 to 3 jobs. The average Joe can't make it anymore. It pisses me off, plain and simple, that we're the richest country in the world, but have third world health coverage. Our system is completely broken, and these cuts are making the crisis even worse. All other developed countries guarantee health care to their people. I have a sister who moved to Canada before COVID, and now she's a resident. At the beginning of COVID, she found out she had lung cancer. Her entire treatment for her cancer, her surgeries, her chemo, all of the care was covered, 100% coverage. It works. I know it works. It's time to kick out every politician who voted to cut our health care. It's time to elect leaders who don't take orders from those people over there and the billionaires, and finally take a stand for the health of their working class constituents, every one of us standing here. Thank you.
Thank you, Helen. So before we close tonight, I want to remind folks that this is just the beginning. Like I said, we're all going to be back here tomorrow when all the legislators are back in this building, and we're going to let them know that we're sick and tired of this and they got to do something different. And as Helen and others said, if they aren't going to stand with us, then we can show them the door. There's an election coming up in November, right? Every single House of Representatives person in here is up for re-election. Half the state Senate up for re-election. If you ain't going to stand with us, then this is not the job for you. We need to elect people who will. Am I right? Yes. And we are not alone. The folks on these stairs represent thousands, thousands and thousands of healthcare workers all across the state of Pennsylvania. And we are joined today in actions across the country to stand up and to center healthcare as a major priority, as something that cannot just be swept under the rug and ignored, something that cannot be cut just so a couple rich people can get even richer. The next 7 days in June are showcasing hundreds and hundreds of demonstrations and vigils like this one all across the country. In fact, in Pennsylvania today, there was a vigil earlier in Williamsport. I know they're coming up in Philly, in Scranton this week. So this is just the beginning of a week-long week of actions across the country, calling on our elected leaders to do the right thing and to stand with working people over the billionaires. But 1 week in June is not enough. We got to keep talking truth to power. We got to keep showing up. We got to get out. We got to vote. And we got to talk to every single person we know, every single person we care for, their families, our families. And together, united, we can make change. And we have to. Because healthcare saves lives. Medicaid
Saves lives.
Penny
Saves lives.
Healthcare
Saves lives.
Medicaid
Saves lives.
Penny.
Saves lives.
Thank you so much for coming out tonight. We will be back.